If you think about the job of our teeth, the first thought usually is that they are responsible for helping us chew food, but they're also important for our speech and for the articulation of words, and also for non-verbal communication. And the most common time we usually show our teeth is when we're happy and we're smiling, and rightly or wrongly, many people can be self-conscious about the appearance or the colour of their teeth, and this sometimes will have an impact on their confidence. I like to tell my patients that this only matters if you think it does. It's definitely not for anyone else or society to tell you how you should look, but if whitening your teeth is something that you're interested in, then this video is for you. So the top 5 questions about tooth whitening. Number 1, does tooth whitening cause damage? And this is definitely the most common question, and the direct answer is no. I think it is a common misconception though, because whitening your teeth can cause temporary tooth sensitivity. Whitening products work by breaking up the tiny stain molecules that are embedded in the surface of the tooth, and when these stain molecules are removed, then the tooth can become a little more susceptible to temperature. It's similar to using an exfoliating scrub on your face and removing oil and dirt from your pores. Overuse of tooth whitening products, or using actually a high concentration bleaching product without professional oversight, though it can cause damage to your gums. So it is important that if you're going to whiten your teeth that you are definitely doing it properly. Question number 2 is, do tooth whitening toothpaste actually work? Whitening toothpaste can definitely work to a degree, but their long-term use is not usually recommended. Most whitening toothpastes, they work because they're more abrasive. And an analogy for this is it's like doing the dishes with a sponge versus a scourer. So for obvious surface stain like from smoking, coffee, red wine, whitening toothpaste will certainly help. But with long-term use, these products can actually wear the natural tooth structure away. This itself can lead to tooth sensitivity, and it can end up actually making your teeth appear more yellow as the enamel layer thins out. Question number 3 is, will it even work for me? And whether or not tooth whitening will definitely work does depend on a number of things, but for most people it will have a positive improvement. One important detail about tooth whitening though is that it's all about stain removal. It doesn't actually make your natural tooth structure whiter, it just removes stain. So that means that whatever colour your teeth are at the end of bleaching is ultimately determined by their natural structure once the stain's gone. So some people have thin and translucent enamel, and some people have thick, milky white enamel. So the actual results that you get are always specific to the individual. And one other thing to consider is that in general, crowns and fillings won't bleach. And this is an important detail to be aware of and to work out prior to undertaking tooth whitening, because even if you do have a crown or a filling, it doesn't mean you definitely can't bleach, but it does mean that careful planning and discussion about the process and outcomes and expectations is essential. Question number 4 is, why are my teeth even stained in the first place? Well, unless you only eat mashed potato and drink water and milk, then the chances are you probably have consumed something that can stain your teeth. And common tooth stain comes from tea and coffee, red wine, smoking. But anything that would leave a stain on a white t-shirt can leave a stain on your teeth, and over time it all adds up. I did the sums this morning, and I think on average I would have 2 coffees a day, which just over the past 10 years is 7,300 coffees, which in retrospect is a lot. So everything makes a difference. And question number 5 is, what are the types of professional tooth whitening? So when we're helping to whiten the teeth of our patients, we'll usually do it in one of 2 ways. It's either in-office whitening, which takes usually one 90-minute appointment. We use a higher concentration whitening agent. It's under close supervision, and from this approach we can usually get them about as white as they'll go in one visit. The alternative to this is at-home bleaching, and what we do for that is make a small mini mouthguard device called a bleaching tray, and you apply a lower concentration whitening agent either for a couple of hours at a time or overnight. And this will usually take a few weeks of bleaching sessions to reach a satisfactory result. Most people do tend to prefer the at-home bleaching option because it is more cost effective. But which one really is best is determined by someone's motivation, compliance, and time frame as well. So these are the top 5 questions that we're asked about tooth whitening, and I will stress that because everyone's mouth is different, it is essential to discuss your individual situation with your dentist prior to considering treatment. And for more information, check out our website or our Facebook page.